With the number of daily COVID-19 cases going up rapidly, Professor Ian Sanne says a surge in hospital admissions must be prepared for.
Now, he says that 75 to 80% of hospitalizations are unvaccinated people, and there's a large number of people who might still become severely ill.
Unfortunately, we do need to prepare our hospitals for surge capacity. We need to look at our oxygen supply chain and be ready to, in fact, address a substantive hospitalization that may occur. Our concern is about the groups that are unvaccinated and perhaps potentially have not yet been exposed. And indeed, that group of people, we don't know the entire overlap between previous exposure and now vaccination, but it could be as large as 40% of the population that has not yet either been vaccinated or had a previous infection with coronavirus up until now. Now multiply the transmission rate that is occurring times the number of people that still can become infected, and a portion of those becoming hospitalized. At this time, we think about 75 to 80% of hospitalizations are in the unvaccinated. And so we have a large pool of people who can still present with overwhelming infection and severe disease.
Tshwane is the global epicenter of the new Omicron variant. That is according to the South African Medical Research Council. It says there's a rapid increase in hospital admissions and infections in the metro. Dr. Farid Abdullah explains further.
The first documented cases of the Omicron variant are from Tshwane. And we've seen an exponential rise in the case numbers, which are sort of linked to the same time as the Omicron virus. I think it's common cause now that the new infections in Gauteng are being driven by the Omicron variant, and Tshwane has had the highest number for the last 3 weeks. Just in the last 5 days, we've had almost 10,000 new infections in the Tshwane district. There's been a rather rapid rise in hospital admissions with patients who have COVID, that testing COVID positive, whether they are presenting with COVID pneumonia or severe COVID disease or other conditions and are incidentally testing positive for COVID is something that I'll say a word about just now. But the rise in infections is rapid, especially in the Tshwane area, and I believe now in most of the Johannesburg hospitals and Ekurhuleni Hospital. So it's rapid. I mean, we're seeing, 10 to 20 admissions a day at Steve Biko, but I can tell you that the hospital admission numbers, the bed occupancy numbers for COVID beds at George Mukhari has grown substantially over the last couple of weeks. Jubilee Hospital, Calafong Hospital. So all of the hospitals in Tshwane, in the public sector, in addition to that, all of the private hospitals are seeing an upsurge. And it's a big increase in hospital cases. And the same is being reported now from Barra, from Helen Joseph, and from Tembisa hospitals. So undoubtedly, there's a rapid rise in hospital admissions, and the COVID bed occupancy is increasing, even kind of increasing 30-40% per day over the last few days.
So let's take a look at the latest COVID-19 numbers now. The country has again recorded over 16,000 cases in the last 24 hours. Another 21 people have died from COVID-19 related complications.
Now, nearly 70,000 tests have been conducted, representing a positivity rate of 23.8%. Over 70% of the new cases are again in Gauteng. The province has recorded just over 11,000 new cases for a second day in a row, and the Western Cape and KwaZulu-Natal both have just over 1,000 new infections in the last 24 hours.